Hi, it's Jay Foster. Join us 7 days a week from 2 to 3 p.m. for Health Connection Radio. We'll talk about natural cholesterol control, toxic metal syndrome, how to reverse bone loss, and the latest scientific research on vitamins and minerals. We'll have fascinating guests, and we'll take lots of your calls, too. So join us 7 days a week from 2 to 3 p.m. for Health Connection Radio right here on WNN.
Elections are now over. Come January, we will have a Republican Senate and a Republican president. This could cause extreme volatility in the markets, and the question you need to ask yourself is, are your retirement accounts protected? If you have money in the markets, it's crucial you know how to protect your portfolios from market crashes, and at Online Trading Academy, we can teach you how to do that. We've been around nearly 20 years and can teach you how to protect your money in the markets through using options, exchange-traded funds, and wealth management strategies. If you want to learn more how to do this, give us a call right now and you'll receive 2 passes for both you and a guest for a free half-day wealth management class. 954-668-2443. 954-668-2443. You need to learn this before the markets crash. 954-668-2443. 954-668-2443.
Serendipity Consignment Boutique is unlike any other consignment shop you have ever seen. Lisa has the most beautiful and immaculate designer bags, clothes, shoes, and accessories. It's a designer candy store. So go check out Serendipity Consignment Boutique, Glades Plaza, 2200 Glades Road, Boca Raton, or visit their website at consignmentboca.com.
Talk health, talk wealth, talk politics, talk 1470 and 95.3 FM, WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, and welcome to the Becky and Boca Show. Tonight I have a very interesting guest that I've wanted to get in here for a long time. This is Dr. Steve Fagan, and one of the reasons I wanted to bring him in is that he did my upper eyelids. I think it was about 18 months ago, and I did a video and put it on YouTube of the progression from right after the surgery to 2 weeks out. And I got so many views on that and so many people commenting on it because it was a lot easier than people think. So, Dr. Fagan, well, I'd like to introduce you. First of all, tell me your credentials. I downloaded your CV and it took up all of the paper in my printer.
Well,
so, what's your easiest title to?
Well, first of all, Becky, thank you for having me on your show. It's been a long time coming. I know we've been trying to get together to do this. Yeah, you
travel a lot,
and you've been terrific, and you're a model patient. So it was
really
easy. My title is oculoplastic surgery. I trained in ophthalmology first, and then I did plastic surgery afterwards. So I specialize just in cosmetic eyelid surgery.
So you're a plastic surgeon for the eyes?
Just for the eyes.
Okay.
And people come to me and they say, well, can you do other things? And I stick just to eyes.
But you're also an ophthalmologist.
Right. So I trained in ophthalmology first, but I don't practice general ophthalmology.
Okay. Did you do any ophthalmology surgery or?
I did in my training, but I never did any ophthalmology or eye surgery in my practice. So I limited everything, and I've been in Boca, hard to believe, 30 years now.
Oh, I know.
I remember when we got here.
I've been here almost as long.
I know. So it's hard to believe. I raised my children here in Boca Raton, so it seems like it went in a flash. But that's what I do. I do oculoplastic surgery.
And you are definitely the go-to guy for eyes around here.
Well, that's nice to hear.
No, you're the best. And what surprised me, I waited so long to do my upper eyelids. They were drooping almost right down to the top, and I kept dreading it, thinking this is going to be some horrible thing. I'm going to have to hide for a couple of weeks.
Yeah.
And it was so easy.
It-
I know
it
it's
can-
because of the talent of the surgeon.
And it
but-
can be, and I think most people that do eyelid surgery, there's others that do eyelid surgery. It's of all the things we do in plastic surgery, it's probably the easiest tolerated.
Well, I did the uppers. Some people have to do the uppers and lowers.
And lowers are not quite as easy, but
Right,
they
that's
can
what
be.
I've heard.
They
Okay.
can be pretty close. I tell patients to come to see me for their upper eyelids, besides telling them exactly what to expect in the course and the result and when they're going to look good and presentable, that there's really little pain, and most of them look at me and go, yeah, right, of course you're going to say that. And then they go through the procedure just like you did, and they go, I can't believe it. I really don't have a day of
There was
pain.
no pain. There were no bandages.
Yeah.
No drains. Nothing.
No.
was
And
just-
upper eyelids are pretty,
I was at Publix later that day.
yeah. I've actually been out to restaurants the evening I've done surgery and seen patients of mine that just had surgery that day out.
Oh yeah.
So it happens. And
Restaurants are dark. You can do that.
yeah, and they with little sunglasses, and they're wondering why they're.
The only thing that slowed me down at all was that I couldn't wear makeup for
Yeah.
a period of I don't
Couple
know.
weeks.
Yeah. So they got red for a few days, but during the day
Yeah.
it was no problem. Sunglasses. We're in
Right.
Florida. That was.
And that's-
I went everywhere.
And it used to be 30 years ago, it was a secret when you had surgery.
Yeah. Oh,
And
yeah.
people wouldn't tell their friends. They would hide out.
That's totally
now,
changing.
That has completely changed. And people are actually somewhat proud of their
Yeah,
surgery.
it's believe me.
It's like a status symbol to have cosmetic surgery. So it's time to change. And it's not only changed here in the U.S. I travel, and we'll talk about this, I'm sure, later. I travel quite a bit and teach in almost every continent in the world.
And it's becoming-
the whole attitude has changed even in Europe.
That's interesting because I thought maybe it was just like Boca Raton and South Florida.
No.
Since there's so much of it that people just are
There,
used
there
to.
is a lot, and we tend to have probably more cosmetic surgery in certain pockets in the U.S., New York,
Yeah.
South Florida, Dallas,
Right.
L.A., Chicago. But now, even internationally, you're seeing areas that wouldn't even consider plastic surgery,
Oh.
much like conservative places like Boston in the U.S.,
Right.
where they are really into it now. In fact, into it with a vengeance. It's like now that they've avoided it all these years, they're very interested about it and very proud of it.
And has it gotten easier for the patient? I know there's difference in anesthesia now than traditionally.
It has. One of the things, exactly right, to your point, anesthesia with certain drugs that are used, like propofol, which is always the
I
fear
think that's
drug.
what used on me.
And it's the drug that Michael Jackson,
But
unfortunately.
everybody's scared of it for that reason, but
Right,
I
but
know it's a
you-
very good drug. And
And used appropriately, it is probably one of the
Right.
best advances in IV sedation. But it's not a drug you take at home.
Right.
So, it is an excellent drug. You have an amazing sleep. You wake up feeling fine and rested.
I felt great after
Yeah.
the surgery.
It's
Like I
very
said, I
common.
went grocery shopping.
Yeah.
It wasn't. There was no feeling bad.
There's
or
no
anything.
hangover,
Right.
so it's an excellent drug, and again, used in the right setting by the right people, it's a very safe drug. So we hear all these horror stories that happen, which are unfortunate accidents, but that should never happen in
Right.
a controlled setting.
Nobody should be doing propofol in their
Not,
bedroom with
no, you don't do it at home.
cardiologist.
Administered by anyone. It's not. You need to be appropriately monitored, and that's the way I do the surgery, as you
Right.
experience. So.
Do you do any eyes with general anesthesia, or is
No.
it all? Okay.
Every once in a while you get a patient and say, I have to have general anesthesia. Or they
Why is
say,
that?
well, they'll say they've tried IV sedation and I never go out completely and I hear and feel everything.
They're afraid they're gonna. Okay.
Right. And,
they're not gonna be able to tell you.
And I will tell you, I've had many of those patients have IV sedation and they don't hear or feel
Right.
or remember
So
anything.
what do you think happened with they got this?
Well, they may have
anecdote?
lightly sedated them with maybe a drug that wasn't as effective
Wasn't
as
the same
propofol.
drug,
And there are some very good drugs, but they're short acting. So
Mm-hmm.
they may have worn off their effect and then they wake up. But usually they don't wake up and they're in pain. But that fear, they want to have general
But
anesthesia.
even if they were in pain, wouldn't the doctor recognize that right away and
yes.
take care of the
Yeah,
problem?
but you have to understand some patients' fears. And so I spend a lot of time with them in consultation and get a good idea of what they want, not only surgically, but how they're going to do as a patient through the entire process. So you have to get to know your patient.
Do you think is it better not to use general anesthesia? Is there any
Oh,
reason that one
yeah,
is
I
better
think-
than the other?
Yeah, I think even general anesthesia is very safe these days.
It's a
But
controlled environment. And
it's
monitored,
controlled,
so
but it's not as safe as IV sedation. I I mean, if you look statistically of where events happen with anesthesia, it's almost never with IV sedation. They're always almost always with general anesthesia.
Okay.
So
'Cause people do always say they don't want general anesthesia. I was just wondering if there's a reason.
and that's why they've heard of or read about a problem with general anesthesia where, oh, am I going to wake up and things like that. And of course, that rarely happens. There's lottery odds that those things would happen. But the safety comparison between IV sedation and general anesthesia, IV sedation is simply safer.
Okay, that's good to know. So you do
All
your
IV
surgeries with
sedation.
that?
If somebody tells me they need general, we either have a conversation and we discuss the fact that I only do IV sedation, or, every once in a while, once a year, somebody goes, if I can't have general anesthesia, I'm not going to do my surgery. And I say, you know what, I don't think you should then. If you're really that concerned, then wait. And if
I
you're,
wouldn't even want the doctor to do something that he doesn't normally do.
and that is a good way to look at it. Yet some people, they have an idea of exactly how they want it.
Yeah.
They want to control the situation.
They want to be knocked out and wake up and it's done.
And what happens is, usually if you let a patient dictate what they believe is what's best, when you believe it's not, you need to back up and say, you know what, maybe this isn't a right fit.
Oh, that's true with you because you don't go overboard on people like a lot of doctors do. And I know patients always want more.
They do, and it's kind of your stamp of approval. So
they're walking around saying that.
Yeah, and I don't want, for just trying to be the right guy for the right patient, I don't want to be that person that just, in order to just get more business, you're doing more procedures. I want my patients to be happy. I want them to enjoy the experience, and the experience has a lot to do with it.
Right.
Our staff is superb. So, we make sure that not only the surgery goes well, but that their experience from the time they walk into the office, by the time they're done. Thank you. Yeah. And we work hard at it, and it's very important to me. I want them to be happy with their whole experience.
A good experience.
And, it's we'll talk about this, I'm sure. I don't just do eyelid surgery, so I do a lot of injectables.
Right,
So,
I go to you for that.
Yeah, so the experience is very important. Pain control. Sure. Patients can painlessly get procedures, so a lot of them are needle phobes where they're really concerned.
That's funny. People that I know that don't do injectables, and that would be nobody in Boca Raton, but people like in Chicago and stuff, they're afraid of the needles.
Oh, sure they are.
They say, I don't want the pain.
And I understand that. And it's completely reasonable to be fearful of needles. A lot of people are, but there are certain ways you can deliver injectables, whether it's Botox or Botox-like
Well, you
drugs.
do a dental block on me when you do
when I do fillers.
lips and fillers.
For most people, except for there are those patients that when they go to the dentist, they don't want anesthesia. They just go straight, which is
who's that?
There's a few, and I have a few in my practice. They don't want any local. But you can give a very quick, effective, almost painless block of anesthesia, like at a dentist's office. That's what we call it, a dental block, where they don't experience not only discomfort, but it reduces the bruising. So patients not only want to not feel it, they want to get back into the world within a day. Mm-hmm. So if they're all beat up and they had a painful experience, it's not a win-win.
Right.
So the experience is very important to me. But for eyelid surgery, you're mentioning upper eyelids. The lower eyelids are at times a little more complicated. It doesn't mean risky or dangerous, but there's more to the lower eyelids that make certain patients have some level of mild discomfort, but never pain.
Okay.
And so there's many ways that I do lower eyelids, and even for upper eyelids, I've written a lot. And I know you mentioned my CV, but I write a lot in the peer-reviewed journals. Particularly, I'm an editor, and I write a lot for Plastic and Reconstructive Surgery. It's the largest plastic surgery journal in the world, most revered as well. And I'm one of the editors. But before I even became an editor, I wrote a lot of peer-reviewed articles about my thoughts and concepts of upper and lower eyelid surgery. So it's changed. And it's changed dramatically.
Do you think it's gotten easier for the patient?
I do. I think the surgery is better now than it used to be, and I think it'll be better in 10 years. I think some of the things we do today, we'll look in 10 years and say, really, we did it that way?
I know. I was putting it off for years, and once I did it, I was like,
yeah, well,
wait.
And there's some advantages. I mean, some people actually benefit from advanced techniques and technology. So I remember I actually did the eyes of my mentor in plastic surgery. And when I was going over the procedures with him, as I do with any patient, but again, one of the things you don't want to do is you have to treat even your friends, loved ones, mentors, you treat them like a patient, because if you don't, things happen. So came in for his pre-op, we're talking about how we're going to do the procedure. He goes, well, I didn't teach you that. And I said, yeah, I know. And he goes, and I go, well, lower lids, what are you going to do? I said, well, and I explained, I developed a procedure called retinacular suspension. He goes, we never did that. And I said, yes, I know. So I think some of the better surgeons have adopted what they've learned in training and developed better techniques that give better results. Because like you said, patients want results, but they also don't want to look like they've had surgery.
Right.
So, and which is, people say, well, that should be, it's not that easy. Whether it's a facelift or a rhinoplasty or having your ears done or your eyes, to get a great result and have patients not look like they've had surgery takes next level techniques and understanding.
Well, your eyelids look very natural, and I think you were explaining to me the difference between, like, a lot of people want those Hollywood big, huge lids.
Yeah, and that was a fad. And, I've given a lecture for years, Marlene Dietrich, Marilyn Monroe. They actually had true lid ptosis or droopy bedroom eyes. And so that became the fad. Everybody wanted to have those very deep eyes with a high softness where you had an inch to put makeup on.
Yeah.
And in some people that looks okay. In most people it does not. And if you look at some of the most beautiful fashion models, they all have very low folds. They have very firm, tight skin and muscle. But their folds, they don't have an inch to put makeup on. But somehow, as we get older, we believe that's what we want because that's what we think of. We see hanging
I've
skin.
talked to people recently that say they want that.
Yeah, and they do. And yet when you show them the differences, and there's some people they insist on that, and you can deliver that surgically. But I think most people look like you take a few years back and you make them look like they used to look, rather than making them look like something they never looked
Completely
like.
different, yeah.
So, you don't want to change people. You'd like to really take back a few years. And I think most patients are very happy with that. The surgery in general should last about 10 to 15 years, but it doesn't last forever. So, patients continue to age, and I tell them they always want to know how long is this going to last. They get 15 years out of it. And that's
pretty good for
that's pretty good.
for all this stuff.
And then the girls in their 30s that have their eyes done, they go, well, how long am I going to need my eyes done again? I said, well, if it lasts 15 years and you're in your 30s, it means you're probably going to want something else in your 40s or 50s. So, I think they're happy with 15 years.
I've seen people doing these little mini eye, like dermatologists doing these little mini eye lift things, and I don't know why anyone would do that when you could just.
Everybody wants to get into the cosmetic business, mostly because it's lucrative. I mean, frankly, they get into the cosmetic business, and you see dentists and gynecologists doing things as well, which is, I actually don't have a problem with it. There's a patient for every provider, every doctor. So everybody kind of gets into everything. They think it's easy. What I found, interestingly, is sometimes you get some of these non-core, what we call them. They're physicians, but they're not in the core dermatology, plastic surgery, face plastic surgery, eye plastic surgery. And they get into it, and then they realize it's not that easy. And they get dissatisfied patients who actually, they're not happy. And they don't, because they've never been in the cosmetic world, they don't even know how to deal with the unhappy patient. What do you do with someone who's not thrilled with their result? And they don't even know what to do. So a lot of them, some of them are dear friends of mine, say, you know what, I used to do that. I stopped doing it. I don't want to deal with that anymore. So, it's not an easy business. You have to deliver. You have to treat every patient like it's your most important patient because they're walking around with your stamp of approval.
Right. Right on their face.
Right on their face. And eyes don't lie. I mean, you've seen plenty of people that have had eye work that is just not okay. And it's so obvious. And bad work is real obvious. Good work is relatively undetectable.
Right. People don't know.
So they don't know it. They don't even think you had eyelid surgery. But they go, you look great for your age. And they go, and I've operated on some A-lister actresses, and they get on TV shows, and one of them particularly, made a mention that when the host said, you look fantastic. And they said, have you ever had any surgery? And she said, no, I've never had surgery. And I'm watching the show saying, that's not true.
Oh, I know.
I did your surgery. And and I called this one particular person up, and she laughed. She goes, well, I just tell people I never had surgery, and that's what you need to do.
But I can even tell when people tell me they haven't done something, and
well, so taking it a step furder, I have patients that come to me in consultation, and they will deny having previous surgery, and they have scars and everything. I said, listen, I understand you don't want to talk about it, but if you want me to do the surgery, we have to have a good relationship and be truthful with each other. And I know you've had your upper eyelids done. And they'll say, oh, yeah.
Why would they not tell?
I wanted to see if you could tell.
Oh.
So I said, really? All right, well, whatever.
No, but your lids do look very, and you do injectables too, and those always look.
Yeah,
very
injectable,
natural on people.
it's the same concept,
I've
whether
never
you're doing...
seen anyone that goes, you get the big duck lips, or
Well, you know, it's like, and it shouldn't be all that surprising. We went from breast surgery where people had, their breasts were too large. We went from lip injections where the lips were just too large. And always when things first come out, everybody thinks more is better.
Right.
And then we went to cheeks. Now we're on cheeks. Everybody's cheeks are sitting out to here.
But now, you as a doctor, don't people come to you and they want huge lips or huge cheeks? Because I
Right.
have
And-
girlfriends that want that,
But you have to be a doctor first.
so you don't do it.
And be a patient advocate. You don't necessarily have to agree with everything that they want. And in my opinion, if you don't agree with it, you shouldn't do it.
Right.
And again, it's a very lucrative business. And I think a lot of people will just do whatever the patient asks for because, frankly, they make more money by
Yep.
doing that. But you've got to step back and go, you know what? You depend on me to give you good advice and to make you look as good as you can look. If I deliver that result, you don't look as good as you can look.
But I've been with people, with doctors,
We all
and they
have.
demand more.
And I just say, you know what? If that's what you need, I'm not the right doctor
Right,
for
go
you.
somewhere else.
You have to. Yeah, again, you know, I'm doing all this cosmetic stuff. I mean, we all went to medical school and we took the Hippocratic Oath and we
Right.
we did all these things to say, you know, do no harm. That's a part of doing harm. So,
I tried to figure out why it is that women want more and more and more. They want people to notice that they did it.
well, first of all, there's a philosophy that they want to get their money's worth. You know, it's kind of like, now I really got my money's worth because my lips are huge.
Yeah, but-
and that's a flawed philosophy and concept. Secondly, I think sometimes the clock gets reset where they think what their normal body part looks like is out of proportion.
Distorted.
And there's a fair amount of what's called body dysmorphic syndrome, where patients' perception of themselves is a little different than what you see. When they look in the mirror, it's not what you see
don't
when you look
see
at
those
them.
big
They don't
bubble
see
lips?
it. And as a doctor, it's partly your responsibility to detect that and not feed into it.
Right.
You're feeding into a problem. And I will tell you, I've had patients who went through a stage like that and they really wanted their lips big, and I would tell them, I think this is enough. Or I would inject their lips, for instance, and they would come back 2 weeks
back,
later
yeah.
and they say, I want them bigger. And I say, you know what? I don't think they should be any bigger. You look great. Many of them come back a few years later and go, you know, remember when I came in and I wanted my lips bigger? I'm glad you talked me out of it. And it's just the right thing to do. And
Yeah.
they get it. Once, you know, I think people just think, again, that concept more is better. It's not better. What looks good is beauty that doesn't look like you've had anything done.
And you are very good at that.
I try my best.
Yeah.
You know, I can't say I hit it out of the park every time, but I try to.
People that go to you don't look done. They look better. They look pretty, and that's an art or a technique. Or
It's one of the things. So one of the things we talked about earlier. I teach, and I travel around the world teaching, whether it's Asia or Australia or Europe or South America, and we teach technique, and we're trying to teach aesthetics. We're trying to teach people and physicians, surgeons, how to look at someone and deliver that best result. That is far more difficult to teach than technique.
Right.
Technique's a cinch. Here's the cookbook. This is how you do it. These are the
right,
steps.
just going through the
Aesthetics
motions
is
of-
much different. And
So, do people just have that? Doctors have that, or they don't, or can you teach that?
I think there's some teaching. You know, we talk about it, and a good buddy of mine, Arthur Swift, who we give teaching courses, and Steve Liu. Arthur's in Montreal, and Steve is in Sydney, Australia. We teach aesthetics. We try to. And some people, like a light bulb goes off. They get it. They've never been exposed to it, and they get it from the first minute you open your mouth. They go, you know what? I never thought about that, but I get it. And some people, they can see the lecture 10 times, and it doesn't resonate. And it's just like, we all can take a paintbrush and draw on a piece of paper. We don't always have a masterful
Right. Yeah,
result.
that's what I'm wondering. What the difference is?
I think we all have the potential to understand aesthetics. I think not all of us can deliver. And, some people use, well, I'm a great surgeon because I'm an artist. I also think that doesn't necessarily equate. There are many people that are really good with paint and clay, but on the face and in the operating room with a scalpel and a pair of scissors, not the same. So I think your best testimony is your results.
Right.
And it always is. You can talk about what you do and where you trained. It's meaningless.
Right. It's well, it's not meaningless, but
Well, let me back up. It's not meaningless. But I think people rest on credentials rather
lot.
than their results.
Yeah.
And I
But
think
you have very good credentials too.
I do. And I'm proud of my credentials, but I think just because
Here they are.
well, just because I train somewhere that's an excellent institution doesn't mean you're going to be necessily good
Right.
at what you think you're good
I
at.
know. I've been trying to figure that out with doctors.
It's interesting, and part of the problem is selection. In the most lucrative, difficult fields to get into when you graduate, when you finish with medical school, they select out for people that are very book smart. And so if you want to get into the top residency programs, you would have had to have been a really good academic student. Where those that are artistic tend to not be in that tier. It's very unusual to get somebody who academically excels and is also in that same group of people and is artistic. So you're almost selected away from that. And I received an award at a society once, and my mentor got up and said, this Fagan was a good student by all measures. He was, in the top of his class and ranking and so forth. But he wasn't the best of all the people that I interviewed for a fellowship. And he took me because he just, frankly, we got along.
Liked you.
He liked me, and we got along, and he changed the way he selected his fellows after that because he realized his better fellows were high academics,
right,
but had an aesthetic flair and were a little more artsy. I'm a musician, and I don't know if that makes a difference.
Yes.
I don't necessarily think playing a musical instrument makes you a better surgeon, but it makes you think a little different. It makes you, you're creative, and you think a little differently. I think you're using a different part of your brain, and he changed the way. Even my chairman in my residency program, he picked me, and I was a good student, but he said he too changed the way he selected his residents based on the fact that he saw that there was something else to look at. And I think medical schools have changed that concept. That's why they're more interested in well-rounded students. It used to be it was just grades, MCATs.
Well, I think it's still grades and MCATs.
It is. But when you are compared to somebody who has the same grades and you have some more interest in your curriculum vitae or experiences that you've had that are out of the ordinary, they tend to choose those students now, and I think that's a good idea.
Yeah. Okay, you were telling me that there's some new things going on in cosmetic medicine.
Well, yes, and the surgery, interestingly, continues to advance. What's been the biggest change in aesthetic medicine are the injectables, and we touched on that. The injectables, for instance, the most popular and the first well-known, widely used injectables was Botox. And
I don't think I know anyone that doesn't do Botox.
And
Boca.
So when I was a fellow, my thesis was in botulinum toxin.
Really?
They thought I was an alien. They said there is no way
to use as a wrinkle remover.
Well, we didn't know about wrinkle removal at the time. I was a fellow in 19.
When did Botox first start being used for that?
1992, and my fellowship was in 1987, 1988.
Oh, interesting.
And when I did my presentation at the University of Illinois on botulinum toxin and all the applications that I thought it could be used for, cosmetic wasn't even thought of.
Really?
Even though many of us, including my dear friends who were the discoverers, Alistair and Jean Carruthers in Vancouver, Canada, they wrote the first article about somebody who was being treated for spasm, and they noted that their frown lines looked better.
Oh,
so that's how it all got started.
Oh my gosh.
And so we were using it for spastic disorders and eyelid spastic disorders, and one of the pioneer of botulinum toxin was a pediatric ophthalmologist named Alan Scott, who owned the patents and was using it for crossed eyes in children because he can align the muscles with weakening muscles. So his fellow happened to be Jean Carruthers, who was the one who eventually wrote the first article for cosmetic use. And he wound up selling his patents to Allergan. They didn't even know what to do with it because they were an eye company.
They weren't using it for...
No, they were using it just for spasm and thought they overpaid for it, which was pennies.
Wow.
And now it's $1 billion drug. So, so that was my thesis. People thought I was crazy. We started writing about it. Jean and Alistair wrote the first cosmetic article about frown lines looking better after Botox. And it's been the most challenged drug in our time because there are actually hate groups that talk about people shouldn't be using
I
that.
know. Yeah, I get a lot of that.
And which is interestingly, but every time they try to demonize the drug or investigate some of the concerns that they have with the drug, they never find any real concerns. There's been a couple of articles in the past few years that are really nonsense. They talk about things that just don't happen in humans in small animal models. It's almost like the
when
saccharin.
it first came out, there was a thing that it was a poison and
Right,
all
and
that.
well, the biggest problem they had is they called it a toxin.
Right.
And by using toxin, that by itself, you think it's something bad.
And weren't people getting it from alternate sources?
Well,
I remember
so
reading about people that had really bad.
There was one of the things about Allergan, and I know Allergan very well because I chaired the medical advisory board for the company for several years. They are really big into R&D and really investigate the safety and efficacy. When you apply for FDA approval, what the FDA looks at is the drug safe and does it work? And this drug has been so vetted, but there are some off-brand botulinum toxins, and there was some veterinarian used. It was specifically said on the bottle, not for human use. And the person in Fort Lauderdale got into trouble using it on his friends. So it's just crazy. But it's now got hundreds of uses. And the interesting ones are the ones in the future. So it's now one of the biggest drugs used for migraine. We know that. So it's a very effective in migraine headache. What's one of the most exciting things is it's going through the FDA trials, which I was a part of in assisting in developing the trials for chronic depression and major depression.
You were telling me that. I find that very interesting. And I was wondering if, people that have Botox are happier than other people.
Well,
maybe
they might be. And there may be other reasons why they're happier.
They look better.
Well, and that was the common thinking years ago because we did all notice that the patients seemed to be happy.
So you're saying it can treat depression through injections
Yes.
into the face?
Right. So there's a dermatologist who is actually married to a psychiatrist in Texas. And many of us, just like the cosmetic use of Botox when we weren't using it for cosmetic, realized, like you had just mentioned, that the patients seemed to feel better after they had Botox. The assumption was, as you have assumed, that because they look better, they felt better about themselves. And you would think that would be a reasonable explanation to why they felt better. Interestingly, myself and several others noticed patients seem to know when they need to come back to get more Botox.
Yes, I didn't even think of that. But
And that is beyond looking in the mirror.
Oh, wow.
And so the hypothesis was something's going on at a central level in the brain that makes people want to come back for their Botox. It's time. And my patients come to me all the time. They go, I knew I was ready for the Botox. Well, what did you notice? Not sure, but I knew I was ready to get Botox again.
Oh, I'm going to pay more attention next time.
And it's real, and
Wow.
it's midway through the clinical trials, and it will go through the FDA.
So it has to be approved by the FDA to be used for depression, is what you're saying?
No, in fact, what's interesting about Botox, for instance, so the frown lines is that everybody that probably gets treated, at least gets what we call glabellar frown lines. That was the first approval for Botox for cosmetic use. Interestingly, everywhere else for years was not FDA approved, whether you treated your crow's feet or your forehead, but you use it what we call off-label.
Okay.
Exactly. You can treat, even before it was approved for migraine headaches. I had patients coming in, they had migraine headaches. They go, you know what, I'm coming here. Yeah, I'll look better, but my headaches are much better when you treat me with Botox. Now we're starting to see the same thing with what's called MDD, or major depressive disorder. So people can use it off-label until it's approved. But, there's certain stipulations and things you have to disclose to the patient when you're using a product off-label.
Well, what about pricing? If you're using it for depression, is the price any different than if you're using it for?
No,
Would it be?
I don't. I don't charge for the whatever the disorder they're coming in for,
Right.
whether it's
That's what
cosmetic
I was just wondering if the
and I don't think
psychiatrist is using it. Is it the same?
Well, the only difference would be when it gets approved, that psychiatrists, just like neurologists who now treat migraine, will probably be able to get insurance coverage for it, unlike the cosmetic use, which is never covered.
Right.
So the pricing will change according to whatever the insurance carrier will pay.
Ah.
So that will change the game a little bit too.
Right.
But it's a fascinating drug. Again, as I said, they try to demonize the drug. It's probably the wonder drug of our lifetime.
The only thing I've ever seen is sometimes people get like a droopy eyelid, but that's just because it's injected in the wrong place.
That's correct. It's not a problem with the drug. It's a problem with the
And
injector.
I know you correct that on people if they have that.
I do, and I wrote the first article talking about rescue therapies when people get a droopy lid after Botox, and some of the eye drops
How do
work.
you correct it?
Some eye drops work.
Eye drops?
There's adrenergic eye drops, and what that means is there's certain drugs that actually cause a contraction of one of the accessory muscles of the eyelid. So if you get a little bit of a droop, use the eye drops until the Botox effect goes away.
Really?
So and I wrote about it many years ago, and people still use those drops. Interestingly, the incidence of a droopy eyelid has gone down dramatically as doctors have gotten, and nurses or whoever injects have gotten more experienced.
Because they know where.
They just know where areas
Okay.
to avoid. And the
What
other
are
thing,
the areas to avoid?
getting too close to the orbit or the rim of when you feel where the eyebrow is. If you get under there, that's where actually
Goes
the muscle
down
that
into-
lifts the lid and it gets under there. And there's other drugs other than Botox that are neurotoxins. So
Right.
that's the classification of drugs. You've all heard of Dysport and Xeomin.
And
they,
are they the same thing?
they're not exactly the same thing.
Because I've had people that get one of those and they say they prefer Botox, and I'm thinking it's the same chemical.
It's not exactly the
chemical
same. They work very similarly, but we know what we've learned, and I've always been challenged when something comes out new that when I speak at a meeting, they go, I want you to talk about the differences between Botox and Dysport or Botox and Xeomin. So I'll give a lecture on the differences between the two. And the same thing happens with fillers. Everybody assumes these fillers, because they're hyaluronic acid, are all the same. So you can make most of the neurotoxins, Botox, Dysport, Xeomin, work similarly. But you can't make them work exactly identically. But you can get the same results. You can eradicate lines, get rid of frown lines, forehead lines. But in my opinion, and I've written about this and I speak about it at the podium, you need to inject these drugs differently because their profiles are a little different. So you wouldn't inject them exactly the same way, and you need to understand the profiles of each of the drug to get your best result. So I can make any of them work, and some last longer than others. And I'm doing a new clinical trial with another new neurotoxin, which is going to be a very good neurotoxin. We just finished a clinical trial with a neurotoxin that's also a very good neurotoxin. So it's such a lucrative business. A lot of these pharmaceutical companies want to have one in their portfolio because they know they can make a lot of money. Mm-hmm. So it's there will be probably at the end of next year, there'll be 5 in the U.S. market.
Really?
Around the world, there's many more. But, our FDA, for many good reasons, is very tough on getting drugs approved. Mm-hmm. And for cosmetic, it's a high hurdle. And it's beyond the scope of talking about it today, but we have the highest hurdle probably anywhere in the world. And for a cosmetic dermatologic drug, it's higher than medicinal non-cosmetic medicine.
Why would that be?
They want to prove that it's absolutely effective without question. And we use what are called ordinate grading scales, where the grades are 1, 2, 3, 4, and 5 usually. And you have to move for a drug to be approved. It can't just be 1 grade movement. It's got to be 2 grades of movement.
So anything new that comes out for our cosmetics is
it's
probably
a high hurdle.
effective.
Yes. There's no. So again, FDA looks at safety and efficacy on everything. Does it work, and is it safe? Are patients getting into trouble? And then what's interesting about a clinical trial is you learn how to inject it. People don't realize when new drugs go through a clinical trial, more often the doctor doesn't understand exactly how this one works versus the one they're familiar with. It's one of the reasons I do most of the FDA studies. I've done the FDA studies for all of them.
You
almost.
did clinical trials for Kybella, right?
I did.
Yeah. Okay.
So Kybella, as you know, is the now approved for submental fat. Mm-hmm. It's the drug that you inject to get rid of the double chin. If the double chin is mostly fat, the drug is incredibly effective. In fact, I was the only surgeon that went to the FDA. I was actually at the FDA panel that got it approved. But it's a very safe and effective drug. It works. High hurdle. It had an amazingly tough clinical trial, but they got what's called a 17-0 AdCom approval. That never happens. A unanimous approval of the drug. The
So
trial
that
was done
means
so
it is
well.
very effective.
It's very effective, and they were so convinced that the drug was safe that it was immediately and unanimously approved.
Wow.
What's cool about Kybella is it's now going through clinical trials for other applications other than submental fat.
You were telling me that.
Whether love handles and what we call periaxillary fat, or sometimes called bra fat, reducing size of buttocks.
But I know it's very expensive just to do
It is.
this area.
And-
so
and-
if you're going to do all of this,
they're going to have to, in my opinion, and I know the executives at the company that own the drug, they will have to change their pricing structure to be competitive. Because a lot of surgeons
Nobody's
will go,
gonna
we'll
do
just do
that. Right.
liposuction.
Right.
And I agree. What's interesting in a limited area like the submental fat is actually reasonable. So,
But if you get rid of that fat there, what about the skin?
well, that's the thing. I think you have to appropriately select your patients. Not everybody who has fat is necessarily a great candidate for Kybella. If you have good skin quality and a full neck, it's amazing. In young men who work out like crazy and they're really buff and they look great, but they can't get rid of their submental fat, weight reduction is not going to do it. And they have usually, young guy, pretty good skin quality. It's amazing.
Oh,
Even for,
okay.
young to middle-aged women who they're really not lax much, but they've always had that double chin, and they've hated it since they're in high
Right.
school. It's incredibly effective. Once you start to have a significant amount of skin laxity, the drug is less effective. Now, we measured skin tightening during the clinical trial.
Wrap it up here. Anything else you want to say? Well, tell us about your practice. You're on Glades Road.
Glades Road, across from FAU at the Boca Raton Regional Hospital, building 660 Glades.
Very conveniently located.
It's a good place, great parking
Right
garage.
on
I
Glades
parked there.
Road, right near I-95, right near the hospital.
Right near the hospital.
And there were so many things I didn't get to with you today. So
Next show,
yes, can I have you back?
of course.
Okay.
Becky,
Thank
thanks.
you. Thank you very,
Appreciate
very
it.
much. And I'm going to try to get through your CV at some point.
Okay. Thanks so much.
Thank you. Okay.
Good.
Serendipity Consignment Boutique is unlike any other consignment shop you have ever seen. Lisa has the most beautiful and immaculate designer bags, clothes, shoes, and accessories. It's a designer candy store. So go check out Serendipity Consignment Boutique, Glades Plaza, 2200 Glades Road, Boca Raton, or visit their website at consignmentboca.com. You've been listening to and watching The Becky and Boca Show. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065. And now, back to the show.
Bring the mic.
Hello. Welcome to the second half of the Becky and Boca Show. And my guest is Joe Eliota. Am I saying that right?
Aliota,
And
close enough.
the reason I invited you here is I want you to help me with my posture.
Well, you and millions of others.
I've talked to you about this before.
Yes.
And I know you have a whole theory about it. And I'm convinced it's not just exercise, because I usually exercise 90 minutes a day and I still find myself hunching over at times. So I want you to correct my posture. And tell us a little bit about yourself, too.
Well, I've been a massage therapist for about 30-something years, and became an aquatic instructor, and I was the director at the Boca YMCA for 3 years back in the 80s.
Okay.
So exercise specialist, massage therapist, aquatic therapy, and it's all about using the body, and it's all about...
I'm trying to sit real straight because I'm sitting across from you, but I don't normally. I find myself...
Exactly. It's just a matter of, like I said in my little handout
you gave
here.
me a handout.
It's an attitude. It's just an attitude, especially if you're uncomfortable, and you can't, and you're finding that you're not getting enough air into your body. The brain is
when you sit up,
sure, try
your
it. Try it. Slump. Go down to some. Take
That
a deep
feels
breath.
comfortable, though.
Yeah, right. Take a deep breath.
Yeah.
Cannot do it.
It's so
You
hard
have
that
to-
when I'm sitting on my computer to sit properly.
Yes. Now, if you have a pillow behind you,
That helps.
that would kind of help. Yeah. And that would force you. Sometimes people sit on the edge of the chair. If you sit too far forward, if you're kind of sitting on the edge of the chair, you have a better chance.
Okay, see, I'm going to improve my posture. This is it. Now I'm telling everybody, so I got to do it.
Let me tell you the one. Let me tell you the one place, and then we can cut this down to like 3 minutes, and then I can.
Okay.
Okay. This point right here. Elevate. Once you elevate that point,
instead of-
then you
so
take the
that's
rib
good.
cage off of the diaphragm. You
Okay.
get more air in your body, and then just think about your head going off of your shoulders and your elbows going down,
Oh, okay.
and you'll feel that.
Yeah, I do.
That's right.
You might not need a neck lift now.
And
Okay, so.
and
we're-
it's
we're
all
trying
about
to-
it's all about making yourself bigger. It's all about like
But
making
I feel
yourself
like
taller.
I can't stay here for a long time because I won't
But
be
you
comfortable.
will. You know, it's just like if you're an exerciser, you don't have the endurance. You didn't have the endurance back there that you have now.
Right.
So it's
So
something.
I'll learn
Yes,
the more
you'll
I
learn.
do this.
So that when you're not up here like this, your body will say, "What's wrong?" If you're slumping, your body's going to come back to where.
What about when I'm sitting on the couch watching TV?
Well, I mean, for brief periods of time, it's okay. Be comfortable. Be happy. You know, that's the main thing. Keep smiling. Tell people, dieters, don't let it ruin you.
Right,
Don't
right.
let it wreck you. Do the best you can.
But what I noticed, the reason I'm concerned is, I do a lot of videos and things about cosmetic procedures and women making themselves look better and younger. But even if someone has the best plastic surgery, if they're walking around like this,
Exactly.
it's worth nothing.
Right.
Because that people see an
Right.
old
And you're
sick
not getting
person.
you're not getting the liters of oxygen in your body that your brain and skin needs. You're not getting all that breath, all that, And so it's about breath. It's about movement and nutrition.
But now, how do we prevent the spine from actually curving?
Just by
Holding it up?
by holding it up. It's an attitude. It's an attitude. I'm wearing great clothes. I just had my hair done. I've just had a complete makeup. Now I want to look
Yeah.
good too.
It's more important than all of that, I think.
Yes,
Yeah.
yes, because you can have none of that and yet be erect
Right.
and look alert and look like you're on top of
And
your
look young.
Yes, yes, and so it's basically an attitude, and eventually, like I describe in this little thing here, the consequences of poor posture will be compression, loss of mobility. We get round-shouldered, and the things
Yes.
that you do when you exercise can contribute to your problem. If you're
Right,
doing a
that's
lot
true.
of chest work, if you're doing a lot of push-ups,
I've been
and a
doing
lot,
the rower lately, and I'm wondering about that.
yeah, well, the
'cause
rower
you're
is
going-
great because you use the back
So it's
muscles.
good, okay.
The
So that's a
back
good one.
muscle. You want to get the back muscles to pull you open here. What happens is that we become round. We
Yes.
hug with the steering
And
wheel.
we're always with our phones.
Yeah, and we're over here. I call it eye neck.
Yeah. Eye neck.
Eye neck.
Okay.
Yeah, you're gonna have people with eye necks now.
Yes.
They're gonna get the because they're down all the
They're
time. like
always
that.
looking like this.
That's right.
And
after a
I'm
while, and
guilty
your
of
body
that too.
forms
Well, how
like
am I
that.
supposed to do it?
Yes.
Supposed to hold it up?
Hold it up. Hold it up in front of you like that.
It's gonna
and
take me a
drop your
while to get
eyes.
used to
Drop
that,
your
but-
eyes down, but keep
but
your
not
head.
your-
But keep your head focused. Yeah.
Okay.
You should always have, even when you're lying down, your spine should always be straight. If you're lying on your side, you just need a pillow of about 2 inches to keep you from dropping down or going up like
Oh.
that. So the spine
You wanna
should
keep it
always be
straight.
straight. And when the spine is straight, then the nerves coming out of the spine aren't impinged. Because if you're off to one side, then this side here is being pinched. The nerves that emanate out from the spine then are crunched. This side is elongated, and so you're going to get this. After a while, you will become what you are. What,
The way you-
Yeah, the way you sit, the way you
I
live.
don't know. I've been sitting straight for about 10 minutes. I'm tired now.
Yes, and then you know what? And then slump down, take a couple of breaths, and then go back into it again. It's something that develops those
So the more I do
erectospinae,
it-
those muscles in your back. They're called the erectospinae.
Mm-hmm.
Yeah, they get tired. They'll get fatigued because you're not used to it. And you see people with that rounded back.
Yes.
And all those ligaments along the spine. Then, when you
And the
become
shoulders
when you
rounded.
become 55, 65, 70 years old, you're gonna have impaired breathing. You're gonna have discomfort in your chest. You're going to feel compressed. Your ribs won't be able to expand. When you take a big, deep breath, your ribs are meant to expand.
Right.
There's muscles in between there. If they get locked down, you won't be able to take a deep breath any longer.
Okay, now what about when you stand? Are you supposed to have a curve in your back?
Yes.
So your butt's supposed to stick out.
Not stick out. It's supposed to be mobile. In other words, if you can move it, there's a you can even do it here. Just kind of rock on your sit bones.
Right. Okay.
Yeah, you rock on your sit bones, and so that kind of mobility brings blood and fluids into the spine. The trick is to keep the spine mobile.
Okay.
Side to side, bending over and back, and rotationally.
Okay.
Once that happens, once you create...
So how do you do that? You do this with exercises?
Yes, just simple movements.
Okay.
I hold on to the chair here, and I bring myself around.
Oh, that feels good, actually.
Yeah, and I hold myself there. Then I come back, inhale, and exhale. Same side.
Oh.
Same side, and the head and eyes.
Has to go that way, too?
Yes, the whole spine, head and eyes. Use it.
Yeah, I feel it all the way up my spine.
Yes.
Okay.
And then come back, inhale, and then go back into it, exhale. Don't push. As soon as you feel the difference, as soon as you feel the change from here, and you feel anything in your back, that's when your body is telling you, that's my limit. So respect the limit, come back to the original position, and resume and go back to it again. And you'll find that after 3, 4, or 5, you're going to be, you're going to have more range of motion. That means that the muscles around your spine, those little rotator muscles and multifidi, they're going to be able to expand just like every other tissue. They expand and give you more range of motion.
So I should do this every day?
Yes, and over, and bending over. So you want to get the spine going over and back and over and back, rotation, and then holding on to here, reach and over to the side. And reach up first, first. Really go for it, even more, and now slowly go over.
This feels good.
Yeah. Okay. As you exhale, then you come back, take a big deep breath. So the rhythm is your breath. You exhale on the stretch.
About the breath. So you exhale on the stretch.
Yes, exhale on the stretch. Inhale. Now, if you put that hand on this, there you go. Now go over.
Oh, yeah. So how many minutes should I spend doing these?
Not much. Maybe about 8. Do about 8 of them.
And you do this every day?
Yeah, a couple of times a day.
And that'll...
Oh, especially if my back is bothering me. Oh, yeah. When your back talks to you, when you have discomfort, or if you have some kind of symptom in your body wants a conversation. Hello, Joe. Hello, Becky. It's trying to get your attention. So what you do is you go to it. Most people, lay people, when they get that symptom, they start walking around like Frankenstein for fear. Fear gets in the way of their healing.
So you got to
what you want to do is
move it.
I'll give you another concept, the sponge. How do you clean a sponge? Under a faucet. You squeeze and relax. So what you just did, you elongated, you opened up, and then you came back and you squeezed and open and squeeze, open and squeeze. So you change the environment within the tissue. You bring more blood and oxygen to the tissue. You elongate. You get rid of any waste products that may have been deposited, especially if it's overworked or if it hasn't been moved in a while. It's static.
So when people get really stiff in their back, that's
when you have to move. That's when you have to move to it. You may not, even if I just talked to my friend in New Jersey. He's on his way to Atlantic City right now to catch a show. And he said he was in pain. And I had to remind him, sit, turn, even if it's an inch. If you feel anything, stop, come back to neutral, and go back again to it. And you'll find that after about 6 or 7, it gets bigger and bigger and bigger. The muscle is now getting that, but it's sponging, it's cleaning out.
Okay.
Okay? That's a very important concept.
Better.
It's a very important
concept. Look how
I'm
sitting.
It's a very important concept.
So the idea is you want to have a lot of room between...
Stay upright from this point right here. Elevate this point here. Keep your eyes straight ahead. Get your head off your shoulders. Elbows down. When people have their arms, see how my shoulders are up in the air with my arms.
So the shoulders have to be low.
See, I have my elbows on the armrests. Mm-hmm. My shoulders are elevated.
Right.
And what a difference when you drop down. Mm-hmm. Now your head goes up. Yes. And you want to open this up. So there's a doorway stretch. What you can do is stand in the doorway and just kind of go forward and come back.
To stretch this out?
Exactly.
I do that on the in the gym with those, what are those things are called? TRX.
Okay.
And I hold on to each handle and just pull forward.
There you go. Now what you got to do is come forward. Yeah, what you got to do is come forward.
Oh, I don't do that part.
The sponge part. So now you got to close it up and then open it up again. So you replenish.
Oh, that's what I'm not doing.
That's right.
I'm just doing the forward stretch.
Yeah, no, you got to come back and forth.
Okay.
After third, this is what I found. I'm mostly doing pain therapy now. Mm-hmm. I'm doing very few just sweetest massages and whatnot. So I'm doing, people come in with a shoulder or a neck or a leg or whatever, and I have to address that issue. And oftentimes I have to show them how to use that particular part of their body because they've got what's called somatic amnesia. The pain, they want to go away from the pain, so they forgot how to move that particular part of their body. They don't move it. And the more they don't move it, it becomes static. It becomes like a puddle out in the middle of the street as opposed to getting fresh blood and oxygen into the area and making it.
So you do that by moving it.
That's correct. That's correct.
That's interesting.
So people should go to their symptoms, but very gently and slow and big. Slow and big is one of my mantras. Slow, so that you can feel it coming on. As soon as you feel it coming on, an intensity of your symptom, then come back to the neutral pain-free position, and they go back to that other position again, back and forth, and you'll find that it gets bigger and bigger and bigger and bigger, and then it's restored, and now you're on your way to healing. That's healing.
Interesting.
Yeah, it's just restoring. It's like restoring the body to its original position.
If you look at like a little 2-year-old toddler, they always have excellent posture.
Yeah.
And then somewhere along the line, we just lose that.
Well, they become sedentary. They have to sit for a long period of time. This is why kids sitting for a long time in a classroom, the teacher has to remind them to sit up straight. Let's walk around the class and let's do stretching and moving and stuff like that.
This guy. So if I'm sitting on my computer at home and I start to slouch,
give yourself, the last thing I say down here is take frequent breaks. You say summary? Yeah. Mm-hmm. Take frequent breaks. So if your body starts talking to you, get up and do a spiral.
And move.
I think
I'm going to try this. I really am.
Yeah.
Because I have been wanting to improve my posture. I've been working on it for years.
It's just a matter of attitude.
And I always go back into, particularly being here now, I have the screen and I see myself hunching over and I hate it. So I really, really want to fix this.
Just don't get too crazy about it.
Well, I will.
Keep smiling.
Okay, so what I need to do is I got to remember this.
There you go.
Okay,
and then take a big deep breath. Think about your ribs expanding this way and front and back. Think about yourself getting bigger. Think about your head going up, your shoulders going down.
Okay, shoulders down.
Yeah.
Head up.
Head up.
Tilted up, not down.
There you go. And if you can, do a shoulder roll.
Okay. And then I like the fact about the hips, you need to move that.
Yeah, well, what you want, it's like riding a horse. You go horseback riding?
No.
Okay, well, if you went horseback riding, you know that you have to go with the horse. So that means getting your pelvis, rocking your pelvis back and forth.
That feels good, actually. Okay.
And then that's for the lumbar region, and then this is mostly for the thoracic region.
I'm going to do this one.
And then for the there, and your eyes, look.
That way?
Yeah, there's muscles in your eyes.
Oh.
So get the cervical spine around, and look as you exhale. You're stretching, so you're exhaling.
I exhale when I'm stretching?
That's right. And then come back, take your breath. And when you're out of air, don't hold your breath. Never hold your breath. The rhythm is your breathing. As you exhale, nice long exhale while you hold a stretch. And inhale front.
I like that.
Yeah.
All right, I'm going to work on this. Next time you see me, I'm going to have excellent posture.
Okay, do the doorway stretch.
Okay.
And the doorway stretch, you have to do different heights.
Okay.
Your arms have to be in different heights in order to get the pectoral muscle.
I've been doing a backwards doorway stretch and then leaning forward, but you're saying...
Think about the humerus, this bone here, down here, up here, and then above. Because you have 3 sections to the pectoralis major.
Okay.
And they all have to be stretched. So the lower...
So I do it at 3 different levels.
That's right. Okay. Or you can do it inch by inch by inch. I go up, I go in, go up an inch or 2, go up another inch or 2.
I'm going to start doing all these.
Yes.
Okay, well, thank you very much.
Yes.
It's been very interesting.
You're
and
very
like
welcome.
I said, I've been wanting to learn this from you for a while, and this time I'm going to do it.
Okay.
So thank you very much.
You're very welcome.
And I'm going to hang on to this so I can
Yes.
refer to it.
Okay, and I'll give you another one here.
Introduction to Postural Analysis. And if anyone wants to get a hold of you, do you have a business? Or?
561-488-1008.
Okay.
Give me a call. We'll make an appointment.
All right.
And we'll sit down. We'll do maybe some pool work.
Oh, yeah, you do water stuff.
Ooh.
Oh, I like that. Yeah. Okay. Thank you.
You're welcome. That's
I'm
it.
about to rev up here. I guess we're not. We're still on the air.
Oh.
Okay, there we go. Okay. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and